use the rule of twos. So roughly you will have about 20 million eggs. But those eggs, they don't keep dividing, unlike sperm. As a matter of fact, they keep dying off. So by the time a woman is born, you actually have about 200,000 eggs left. That's a rapid decline, isn't it? Now, these eggs go through a process of division, so that they can, you split one to make two, but the division in an egg is frozen. And that freezing stays in place till a woman hits menarche, which is when she starts her menstrual cycle. So you resume division, your menstrual cycle, we call it the HPO axis, the hypothalamus pituitary ovarian axis kicks in, you start having your menstrual cycle. Now, what happens is, even though everybody kind of knows that we ovulate one egg at a time, what most people don't know is that the ovary is constantly churning over your eggs. So you get a wave of development from tiny follicles where the eggs are housed. And when they get to about 8 or 9 millimeters, they fall off unless they're picked up by the brain. And that activity kind of comes in waves. So a lot has been elucidated over the years. Now, what happens is the brain actually selects a few with a hormone called follicle stimulating hormone, which coming from the brain stimulates the ovary and picks up, if you will, a bunch of eggs, not just one. That bunch of egg now starts to grow, out of which one becomes the dominant follicle that ovulates. The rest in that basket dies off. So you see, there are two places where the eggs are dying off, right? So when you pick up a bunch of them, one will ovulate, the rest of the bunch will die off. But throughout the entire month, you still have some that are in the lower part constantly going through a wave of dying off. So by the time we hit around age 50, for some women, it may be sooner. You're done, you're out. Basket completely empty. So your ovaries are depleted. So in addition to constantly losing the numbers, these eggs are getting older and they're getting harder to fertilize them. So when you get closer to an age of 40, for instance, the ability to fertilize the eggs and get good embryos starts to really fall off. And no magician can wave that back, by the way. Okay, so there is an age where you have the most, not the most really, but the healthiest number of eggs before you start that rapid decline, right? So usually we say before age 35, but really starts a little bit around 32. And then steps up by 37, nosedives at 40, and then it goes on down. So you get to a point where you no longer have as many, and the ones you have are no longer as competent. So that when you fertilize this older, incompetent eggs, your chance of getting a genetic accident goes up. Now, the simplest way to think about it, this is really, really simple. Imagine, if you will, if you have an egg, right? You have the DNA. It's lined up along the axis of the nucleus, and it's held down by telomeres, by little chains that tether it at both ends of the nucleus, right? This DNA is waiting to be fertilized with sperm DNA that comes along and sort of lines up, so chromosome 1 to chromosome 1, 2 to, and so on and so forth. But if the eggs are starting, the telomeres holding the DNA start to fracture with age. So instead of lining up properly, you might get, a stagger, if you will, right? That's a simple way to look at it. So the embryo that results, instead of getting 2 full complements of chromosome, can start missing some or have an extra one here. We call those aneuploid, or I like to think of them as genetic accidents. Most genetic accident embryos will not even implant. And if they do, they may miscarry. Very rarely they do develop, and you get severe birth defects. Very few chromosomal anomalies can survive. The ones that do survive, the ones you see the most, are Down syndrome who will make it. But even the vast majority of Down syndrome infants actually get spontaneously aborted. And the incidence of aneuploidy, the incidence of the genetic accidents, starts around 30, 32 for someone in their 30s, 32-year-old. You go up to about 41-ish, 45% by age 35, 37. By age 40 and above, this incident goes up to about 82%. So when women come to see me at age 44, for instance, you have to be careful and let them know there's a high risk that they may have, out of 10 embryos, 8 may be abnormal. Now, 2 may be normal. So you can actually go figure out which one is abnormal genetically and which one is not. And you can help the patient by only implanting the normal ones, okay? Because the abnormal ones will not fertilize, and it won't implant. It leads to heartbreak, it leads to depression, it leads to treatment fatigue, where people are going, doc, why me? Why is it not happening? So there is a timeline, if you will, when you can optimize getting good eggs and getting a lot of them. And that's what egg freezing does. Now, another thing that egg freezing does is, we all know that if you do IVF, like I explained to you, you fertilize an egg, you get an embryo. In the past, before we could test which ones are normal or not, you may end up with a lot of embryos that you may frankly not implant. Let's say you have 10 embryos. We're not going to implant 10 embryos in your tummy, right? So you'll end up with embryos that you won't use. So one of the benefits of egg freezing is, why don't you freeze the eggs and only thaw that which you will use? So you can choose to say, okay, I have 15 eggs. I'm only going to thaw and fertilize 2, because that's all I'm going to put back in. So I'm not creating more embryos than I need. Another place we freeze eggs is, we get a lot of cancer patients that are about to start chemotherapy. So I'll get a call saying, oh, so-and-so is starting chemotherapy in 4 weeks. Well, we run into high gear and try to stimulate their ovaries and get as many eggs as we can possibly salvage and save for them, so that they can go through chemotherapy. And then when they have fully recovered from their cancer, they can come back and use their eggs, or they can have a surrogate carry it for them. Okay, so that's a brief introduction of what goes on in your ovary. Now let me click next here. Why is it not going? Oh, okay, finally. How do we get these eggs? Well, you don't just go into, oh, I had a picture here. I don't have it anymore. Let me see. You don't just go in and pluck the eggs, because the eggs are not lying in a mature state. You actually have to mature the eggs before you can collect them. That process is called ovarian stimulation. There are different protocols that you can use to achieve this. But typically when you get started, it takes about 10 plus or minus 1 or 2 days to completely stimulate the ovaries. And during that time, you're actually monitoring the ovary, monitoring the growth, and seeing how big the follicles are. And when the follicles are big enough, then you surmise that the egg contained within it must be mature enough. And you can now go under anesthesia, collect these eggs. Now, the thing with eggs is, unlike sperm, they can't hang out forever. So when we collect the eggs, we usually try to freeze them almost within the first hour to 2 hours. What are the chances of you coming back to use your eggs, and that the eggs will give a live birth? Well, believe it or not, there is a high fall-off rate. You actually need a lot of eggs. You need close to 10 to 20 mature, not immature, not the degenerated ones. You need 10 to 20 mature eggs in order to assure 90% live birth. If you're 35 years old when you froze your eggs. I mean, you can come back and use your eggs when you're 45, hopefully not 50, but You can use it anytime. But the ability of those eggs to produce a live birth depends on the quality of the eggs, the maturity of the eggs, and how many you have. So the older you are, the less effective you are. So as a matter of fact, if you're 42 and telling me, oh, I want to freeze my eggs at age 42, I'll probably tell you, I don't think that's a good idea, right? You may have waited too late. What is the workup that you need? Well, we usually check your hormones around the second or fourth day of your menstrual cycle. We also do something like do we do an ultrasound and look at the ovaries and actually count how many small follicles can we see? Those are the antral follicles that I told you are constantly churning through the ovary. The more of them you can see at any one time, the more you are most likely to collect eggs. So we call that the ovarian reserve, if you will. And those same follicles also produce a hormone called anti-Mullerian hormone, right? So you can have your anti-Mullerian hormone checked. If it's low, then that gives you pause that you may be running out of eggs. And if it's high, then you probably have a ton left, right? You've got time on your hand, right? So I already talked about it takes about 10 days to stimulate. We collect the eggs using sort of like, the one you might do with sedation dentistry. But in my case, I prefer to use a board-certified anesthesiologist because I don't want to worry about how comfortable the patient is while I'm focused on collecting the eggs, right? I want to focus on what I'm doing and do that best and let somebody who's good at sedating the patient, making sure they're comfortable, making sure they're safe, and let them take care of that. And then there's a process of recovery. They usually recover usually very fast because we're freezing the eggs, we're not putting embryos back. So patients really bounce back real fast. All right, so that is my introductory mini slide. And I'm going to open up questions if you guys may have that we can talk about.
Thank you so much, Dr. Famuyiwa. Dr. Famuyiwa is a fellow of the American Congress of Obstetricians and Gynecologists. We'll go to Dr. O to shoot the first question.
Thank you so much for the opportunity. Well, I say greetings again. I forgot to tell you greetings from Jamaica.
Oh, wow. That's wonderful.
And I just want to thank Minister Gustav and Dr. Ephraim and Hannah Ajay for holding down the fort. You wouldn't know if I didn't tell you, would you? I'm in Jamaica, enjoying the great food and the weather. It's kind of hot some days, but it's been nice generally. So thank you so much, Dr. Famuyiwa, for just helping us understand again why we have so much infertility these days. I see so many young couples come to me with problems of infertility, that they cannot get pregnant, or they get pregnant and they lose the baby or whatnot. It's shocking to understand that at the age of 31, it may actually be getting too late to preserve one's eggs. So a question that some people have asked me is, apart from the process, how much does it cost to preserve the eggs?
So there are several things you need to be aware about. I mentioned that we need some sort of workup. We can't just jump in there. We need to check your hormones, and nobody's going to freeze your eggs unless they do a recent, within 6 months, HIV, hepatitis B, hepatitis C, and syphilis test at the very minimum. And then you need the ultrasound to do the antral follicle count. So typically, we're fortunate in the state of Maryland, that workup is typically covered by insurance. The egg freezing is not covered. So we charge 5,500, and I know we are probably one of the lowest, if not the lowest, in this area. Most people charge more than that. But be aware, we don't provide the medication. So you will need medication, and you will need an initial workup. So the medication can, depends on how old you are and how much you need. The medication can run you like a couple of grand. But again, if the younger you are, the fewer medication you need, the cheaper it is for you. The older you are, the more medication you need, it's a little bit more pricey. So yeah, usually about 5,500. Now, I should mention, you notice I put in that slide that for women over age of 35, you want to try and save as many as, up to, if you can, 30 mature eggs. Sometimes you are not going to get that many eggs in one cycle. So most of my younger patients, where I freeze their eggs, we get to what we need, and we get a lot of mature eggs. So we get around 15 to 20 in younger women without any stress at all on their part. Some of my older patients may choose to go through at least 2 cycles to make sure that they have stored enough.
And just to clarify with that, is that 505,000 each cycle? And does that include like the storing of the egg for however long?
Let's not be mistaken. I'm not going to give away the barn here. 5,500 for the procedure. We don't store long-term here. The only time I store it here is if someone tells me they want to do a second cycle, then I'll hold it for like a month or two while they go through a second cycle. And then when everything is done, it has to go through a long-term storage. Because some patients, I have patients who are coming back to use their eggs. Some patients don't come back for 9 years. I'm not going to keep it here. You want a place that's tornado proof, earthquake proof, fire proof, any kind of proof. And they have those sort of storage all over the US in deep silos, because remember, this is the most valuable thing that a woman has, are her eggs. So there are places that can provide excellent storage with maximum security, if you will. And we encourage our patients to store in those facilities.
So just to piggyback again on that, the procedure itself,
yes,
it's 5,500, but there are workups that need to be done, exactly. The genetics and stuff like that. Roughly how much would that cost?
No, I encourage women to do a genetic screening if they want, but it's not a prerequisite to freezing their eggs. Okay. The lab work depends on if you have insurance or not. Most people who have Blue Cross Blue Shield in the state of Maryland, it's covered. It's covered under their insurance plan. I'm not sure what the labs are charging. It might be a couple of $100 to do all the lab tests. And I know in Montgomery County, for instance, you can get things like HIV, hepatitis B, syphilis, hepatitis C from the health department. I don't know about other counties, so that takes it off. And then the only other thing we do, there is an initial consultation. That's not part of it. It's not part of it. At 5,500, that's rock bottom. I go any lower and I might be, sending out a GoFundMe. So there's an initial consultation you have to pay. The ultrasound, the initial ultrasound, if you do it at the time of the consultation, is $200. So there is a workup. If you're not sure what your insurance will cover, if you contact us, we can look it up for you and let you know. Otherwise, we can give you a separate price for what your workup will be. But a lot of times I tell my patients, if you want, get your primary care doctor. And I have a couple of friends who are gynecologists and primary care doctors. I tell them what workup I need. Let your primary care doctor do your workup. I'll tell them what blood work I need: AMH, FSH, LH, estradiol, progesterone on the 3rd day of your period, plus your serological testing for infectious diseases. And then the rest is the consult with me and the initial ultrasound, and boom, I'm ready to go.
Thank
Fantastic.
you. Just a follow-up on that. Are there payment plans available?
So we use, first off, we don't have one of our own. We encourage people to apply as far as they want to, but there is a company called Prosper Health that does mostly fertility financing, and they let you spread the payment over 3 or 4 years. So a lot of my patients will choose to do that. And then I tell my patients, look, if you have a personal relationship with your own bank, you will probably get the best finance rate from your own bank if they know you.
Right. Thank you. How long does it take, the process itself?
So if the workup is done, and remember, the workup has to be done around your menstrual cycle. So by definition, that's going to take up 1 month, right? Because we have to do the blood work on the 2nd, 3rd, or 4th day of your menstrual cycle, right? If you do all that workup, then I can get it started. I usually try to, depend on how old my patient is and the protocol I use, I may do what's called estrogen priming, which I give the patients a little bit of estrogen before the subsequent cycle. And all that does is when I get ready to stimulate them, it makes sure that the eggs are growing all, the same size. So I don't get some that are really, really big and some that are really, really small and some that are intermediate. And then not all of them will be mature. So within 2 menstrual cycles, it can be done. The only thing, the limiting factor is patients getting their workup done. Like, sometimes I have my staff call patients and say, okay, Miss So-and-so, have you, done your blood? Oh, gee, I missed it. I can't do it without your blood. Or if you haven't done, your HIV testing, your hepatitis B, hepatitis C, and syphilis, the storage facility will not accept it.
So I have some questions here.
Okay.
How significant is the nutritional status of the woman? And to piggyback on that, a follow-up question is, how significant is obesity? Dr. Bill wants to know.
So you mentioned something that's one of my favorite topics. Your eggs are as good as healthy as you are healthy, right? So I start telling my patients at least 6 weeks before you plan on collecting those eggs, start making sure that you're eating a lot of vegetables, a lot of fruits, whole grains, nuts, berries that have rich in antioxidants, green leafy vegetables. In other words, what's your diet? So cut down on animal fat if you can. I personally don't like meat, but you can eat things that like red snapper, salmon, things that are rich in high omega-3 fatty acids, nuts, avocados that are healthy. If you cook with olive oil or canola oil that have less saturated fats in them, all those things, number one, they make you healthy anyway, right? And then also you live longer. But guess what? Your eggs are going to come out healthier. For my older patients, I may throw in a CoQ10 supplement to help egg quality. But we have what we call our fertility action plan that we give to all our patients. And it lists all these diet plans that because people always ask me, what should I be eating? So I took the time to actually do some research on it. And I put together a list of not only what you eat, but what else can you do personally? And it's the same thing that will make you live longer anyway. Things such as move, get up, move, walk around, exercise, sleep, right? Good sleep, exercise, keeping your body healthy, removing stress. Guess what? All those things peter down to good eggs.
Fantastic. That's our nutritional expert who asked that question. And he had another one. Does medications play a particular role in the level of fertility?
Can you please clarify what medications are we talking about? Medication for illness, fertility medication, what medications?
Dr. Bill, kindly unmute and ask that question.
I would say, example, some of the patients might very well be on hypertensive. They could be on insulin. They could be on anti-infective agents.
Yes.
The role of medications is across the board at this point in time, and sometimes you get a patient in the middle of a course of a treatment at this point. What do you do? How do you handle that?
Okay.
Okay, go on. Let's answer that question first. I have others.
Thank you so much. That's a good question. So again, we're freezing your eggs, right? We're not going to have embryos around. So I'm not worried about, anything affecting development of the embryos. So I usually tell patients, number one, if you're diabetic, I don't like to do it because there are complications that could occur. You want your hemoglobin A1C to be extremely well controlled. If you can get it below 6.5, that would be fantastic. So I always tell my patients, go see your primary care doctor. You need to be fine-tuned, right? Your body's like a little locomotive engine. I need it to be tuned up before we get started. If you're on hypertensives, if you are extremely hypertensive, we will not do an egg retrieval. And that's because your blood pressure could spike during the procedure, right? So if you're not controlled, then you have to go back to your primary care doctor, get that blood pressure into good alignment, really well controlled so that you can go through the treatment. Same thing, if you're asthmatic, your asthma has to be under control. Remember, we're going to put you under sedation. We do not intubate you, but you do have to breathe on your own. So that has to be controlled. If you're now the only people that so a lot of different things. For people who are on chemotherapy, we don't always have that choice, right? So we try to get them started before they get the alkylating agents done. And for patients who are on antipsychotics, antidepressants, I always tell them, you need to be seeing your counselor, working with your psychiatrist, because you cannot go through the rigors of a fertility treatment if you are emotionally not in a good spot. So that is one of the indications for actually not going forward. So that has to be well controlled. So for my patients who have chronic medical problems, I always tell them, let's work together with your primary care doctor. Let's get you into alignment. Now, there is argument in the fertility literature about women who are overweight. We do like to have them try to lose weight for several reasons. Now, if you're putting someone who's extremely overweight under anesthesia, there are anesthesia complications. Remember, they have to breathe for themselves. They have to be able to move their chest gate. So if they're overweight, I don't want their lung mass to be collapsed under them. But by the same token, you have to balance it with how long will it take this person to lose the weight versus how old they are, and worrying about, are they going to lose the eggs that they have left by the time they finally get the weight done? So if you're even remotely thinking about freezing your eggs, start working on your weight like your life depended on it, because it makes it much easier. And plus there are less complications. And remember, I use board certified anesthesiologists. They are well within their medical rights to cancel a patient on the day of egg retrieval, right? So, and I've had one do that, said, I'm not going to put this person to sleep. She's too overweight. She has to lose weight. So guess what? She's lost all the money she spent buying the medication, right? The time put into it. So it's better for people who are really complicated, I might get an anesthesia consult first, but usually we tell them, you need to get your BMI as low as possible. Work on your weight. It can be done. It takes a lot though, and I don't belittle that by any means. I know it takes a lot, and you might need a physician to help you.
And just to piggyback on that, a lot of times with the overweight patients in primary care, it's even harder because they usually don't have a regular menses. So it's like their menstrual cycle will come once every couple of months. So, and that's why we also have to get their weight in the right BMI so that they can have a regular cycle that can be something that can be relied on.
Yeah, I agree with you, but I don't let that stop me though. I can stimulate them in spite of that. So for me, it's the weight is more important. There are other things I can do about their menstrual cycle that won't stop me. So
you have another question.
If they have irregular cycles, by all means, please still send them, because there are things I can do. I can manipulate it. I can get to where I need to get. I don't need to wait for their cycle.
It's clear that the situation here is that you are basically harvesting as opposed to watching the quality of the fertilized egg and how it will grow and produce at this point.
So remember, we are talking about freezing the eggs. We're not talking about fertilizing. Now, when we fertilize them, that's in vitro fertilization. That's a whole, we'll come back on a whole different show for that. That's separate. But we do have to monitor. You're right. You need a lab that's competent. When you start fertilizing those eggs, believe it or not many people can adequately thaw the eggs. Be careful where you take your eggs to be thawed. And I'll give you a little bit of an anecdote. I had a patient who told me, oh, I'm going to Nigeria. Well, there are good, places there, blah, blah, blah. Oh, no problem. They shipped it out, blah, blah, blah. And this was actually, we had embryos in this. They're beautiful embryos. They could not adequately thaw it, and they lost all of it. So be careful who thaws your eggs. Be careful who not only thaws them, but be careful who fertilizes the eggs.
Okay.
So for people who just joined in, this is a talk to help women so that when they're ready to start procreating, when they are ready to start having children, that they're not scrounging for somebody's eggs, surrogate eggs, because their eggs are too old or they are not good enough to be fertilized to effect pregnancy. So women are waiting later today to get pregnant. They're waiting longer and longer. Women are not getting married in their teens and 20s like they used to. They focus on education, profession, and all of that first, and they're getting married later, or they decide later, much later in years, to start having their family, getting pregnant. And that's the purpose of this talk, so that when they are ready, they would have those eggs that are healthy and beautiful. I love the way Dr. Famuyiwa said that. They were beautiful embryos. To capture those embryos when they are still beautiful and healthy, so that when they're now ready to procreate, they will be there for them, and it is their eggs.
Yeah.
Correct? Am I right? Summarizing? Okay.
That's a very good, yes.
Go ahead.
No, yeah, it's very, very important to make sure that we're getting the eggs when they're young. If you don't get your eggs when they're young, then the chance of having a live birth is low.
And you also said that as early as 31, young women need to start thinking about freezing their eggs. I just wanted to make a comment about the medications. There are, like Dr. Famuyiwa said, as a primary care physician, I get lots of patients that have to control their blood pressure. So if they're looking to get pregnant or they're pregnant, there are certain medications, that is high blood pressure medications, that we will not use. But not because it will cause them not to get pregnant, not for fertility, but it can cause problems with the baby, with the fetus. And we don't use those in pregnancy. So we use certain blood pressure medications to control blood sugar. We use insulin, because there are medications that they can use outside of pregnancy, but not in pregnancy, so it doesn't negatively impact the fetus, the growing baby.
Yeah. So, and again, as long as the eggs are not fertilized yet, that won't impact it too much, right? Because we're dealing with eggs that have not been fertilized yet.
I had a question. What is your thoughts or recommendations for a patient who has already had successful pregnancies? However, now they're getting a little bit older and they're now struggling to have get pregnant again. Do you think this is beneficial for them to go through this process, or is it more trial and error that they should continue to go through?
So it depends on their age, right? So if someone's 42, The, what do they say? The cats are already at the band by then. So, you can still try to freeze your eggs up until age 37, 38, even as much as 39. It may mean that instead of doing one cycle, you may have to do several cycles in order to get the adequate number of eggs that you would need.
But it is okay to recommend them to do that, even if they've had been successfully pregnant and had live births.
So again, doesn't have anything to do with if they've been pregnant in the past. It's just a matter of how old are those eggs at the time that they need it. How old are the eggs? So as they get older, it's getting harder to fertilize the eggs. So as older eggs, harder to fertilize, and you will need more of them in order to get adequate numbers. So I think, let me tell you, there was a study that was done for OBGYN residents, and they were surprised that a bunch of them did not really realize that their eggs are getting older. And these are doctors. They didn't realize that their eggs are getting older because they're busy, doing their residency and their fellowship, and they're doing research, but time is slipping by. So you have women who are, in their 30s, they might really need to start thinking about, okay, you know what, now the only disadvantage is that you may freeze your eggs and maybe get pregnant on your own and never have to need it, right? You may never need those frozen eggs. But the thing is, if you happen to need them and you did not freeze them, you run the real risk that in your 40s, you may end up having to use donor eggs. So as long as you're okay with that, then it's not a problem.
Thank you.
Any other questions? I'm gonna stop sharing this.
Yes, there's a question in the chat. Says, what about the effect of COVID vaccine on fertility?
None. The COVID vaccine has been shown to be safe, completely safe, has nothing to do with fertility or pregnancy or childbearing, completely safe to use with fertility.
Thank you so much. How well does egg freezing work?
It works just great, depending on the skill. See, egg freezing, the reason it took a long time for eggs to be frozen is because the egg, unlike, what happened to my screen there? Unlike, can you hear me? Okay. Oh, wait a minute. Okay, that's fine. Unlike the sperm, that's a small cell. The egg is a big cell, right? And most of your cell is water material, right? So in the old days, they used to do what is called a slow freeze. And the reason you do that is when you freeze the egg, you run the risk that the water in the cytoplasm can crystallize and form ice crystals, which inside the egg is going to act like somebody put ground glass and sort of chew up all your cytoplasm and everything in there. So what you want to do before you can safely freeze, over the years, they developed, and it's no longer experimental, they developed a technique where you actually first suck out the moisture out of the egg. You have to dehydrate it, sort of like, and that's where the name vitrified comes from. So you suck out all the eggs, and then you put it in liquid nitrogen and then freeze that.
Right, there's another one. How long can the eggs be stored?
As long as you want. Now, there are some countries, I think London, they're starting to overturn it. But in London, you are limited to 10 years, right? America doesn't have any such limits. So as long as you keep paying your storage fees, they will store it. If you don't pay your storage fees, they'll probably get rid of them and still come after you for the storage.
One additional question that I frequently get is people who are, patients who are using their life savings to kind of do this egg retrieval, and their biggest question is, how do I know if I'm going to a reputable place? How do I know if this is a place I should be putting my money into? Are there any red signs, red flags, or anything that they should look out for?
Number one, talk to people who've gone to the same place that you were thinking of going to. So, what are they saying? What was their experience like? You can ask them for what is their success rate. Remember, we're talking egg freezing. So most people, I would hope, in 2021 should be competent enough to freeze eggs, right? It's not the freezing is easy. It's the thawing and making it useful that sometimes can be hard. But you can talk to most places are good nowadays. So you should also, well, at least in America. I don't know anywhere else. And also go there, talk to them, see if you feel comfortable, right? Or if you feel like you're a number. Are they going to rubber stamp you, toss you out the door when they're done? Now, if that's the way you want to be treated, that's okay too, right? So, go there, if you feel comfortable, if you like the way you're treated, talk to people who've gone there, and then, do your own homework.
Well, on that note, I want to say that I strongly recommend Dr. Famuyiwa. From experiences of my patients, we've had 100% success as far as for now. Everybody I've sent over there. And through her also, I found out that sometimes it's not even the woman's issue. Yes. It's a male issue. She's very thorough. She gets to the nitty-gritty. And so I strongly recommend her if you need that help, that care. I also want to comment on the vaccine. There has been documented incident, at least one woman in New York, a healthcare worker who got the vaccine, the COVID vaccine, 2 weeks before delivery. And COVID antibodies were found in the baby. So she actually transferred immunity to the baby, brand new baby. So as far as we know, the vaccine is safe. Then there's one question before I transfer it back to Dr. Minister Gustav. Dr. Bill also asked about immunization. He said, now, where's the question? He said the prevalent flu vaccine is quadrivalent. Does the mercury impact fetuses, the flu vaccine?
To my knowledge, no. As a matter of fact, the American College of OBGYN actually even recommends people who are pregnant to make sure they get the flu vaccine. To my knowledge, not at all. And they worry about, the thing is, most pregnancies are simple, straightforward, right? People do it all the time and deliver a healthy baby and you get a healthy mother. The scary part about pregnancies are when things go wrong, they can go wrong really, really, really rapidly. And that's why you still hear about maternal mortality. People are still dying, so, it's better to be protected with a vaccine than to come down really sick while you are pregnant, right? Your body doesn't handle that very well. You don't have as much lung capacity because your lung has been pushed up from below with a pregnant belly, right? So when you have something compromising your lungs in form of a pneumonia, you don't have as additional capacity. Your body doesn't give you too much forgiveness. And that's why pregnant women who end up sick, who end up in the ICU, actually tend to do worse than their non-pregnant companions.
You are listening to the Medical Mondays with Dr. O, and we are talking about egg freezing. Don't forget to ask your questions in the chat, or you can raise your hand and you will recognize who asked. Medical Mondays is on YouTube and Facebook. Medical Mondays with Dr. O. Please click the like button and hit the notification button so you can know when we are on air. I have a question From the chat, it says, what are the chances of a successful pregnancy using frozen thawed oocytes?
So now I can make your success rate as high as 95% given certain clauses, right? Because the success rate is age dependent. The older you are, the lower the success rate. You're over 42, you're looking at 3 to 5% success, right? And the younger you are, the higher the success rate. Now that comes with a little caveat. I already told you about trying to make sure that we have genetically normal embryos. So if you have genetically normal embryos, your chance of success is very high. Can be as within 3 transfers, can be as high as 95%. Now notice I say within 3 transfers of a genetically normal embryo into a normal uterus. Those are the caveats, right? So if you have fibroids, endometriosis, there's some negative factors acting on the uterus. And also getting to 3 genetically normal embryos may not be as easy as you think if you're 41, 42 and older, right? So the younger the age of the egg, the higher the chance of getting a genetically normal embryo, hence the need to freeze earlier. So if you freeze earlier, you have a genetically normal embryo, you have a normal uterus, your chances are as high as 95% within 3 attempts,
Thank you so much, Dr. Jamie Famuyiwa. Let's go back to the economics of egg freezing. And there's another question concerning that. It says, how much are the average storage fees per year?
It depends on what long-term storage. When we store, and I told you we only do short-term, we charge $50 a month. But when you move it to a long-term storage facility, that amount goes down, right? So you just have to, we use a facility called Reprotech, and honestly, off the top of my head, I know it's lower than that, but I don't know the exact amount. But there are several edge storage facilities around the country, and you can just simply do your homework, find out, or use the one we send our patients to, which is Reprotech.
Let me take this question and then I'll go over to Dr. O for any further questions. Are there any studies that have compared the use of eggs that have low or short-term storage as compared to eggs that have been stored for a long term, like between 5 to 10 years?
Yes, I mean, there are people that have started originally freezing eggs, and this is not new. It's been around for, years, over 10 years now. It doesn't make any difference. The only difference is if your eggs were frozen with the old technique of slow egg freeze, which almost nobody uses, does that anymore. If they're vitrified, remember, they're under liquid nitrogen. So they're basically in stasis. As long as they're within the liquid nitrogen, nothing's going to happen to them. Now, if the liquid nitrogen dries up, that's a whole different case.
All right. Okay, so this one said, Dr. Famuyiwa, I just want to hear your thoughts. To some, they say if you're not sure about kids, you don't have a partner, or just aren't ready for children yet, you might want to consider egg freezing. Is that right?
Correct. Absolutely. One of the things that I see is, I've been practicing for a long time now. And I remember back in the day, I would see women who are almost desperate to get into any kind of relationship because they're worried about they're running out of time. And sometimes these women get into very abusive relationships, right? So that's not necessarily the wrong thing or the right thing. Now, there are other women who decide, you know what, I'm tired of waiting. I'll just go ahead and use, donor sperm and get my child. I mean, everybody makes their choices. But then, maybe Mr. Right comes along and then you say, wow, gee, I wish I had waited a little bit. So egg freezing gives you those options. You can freeze and then say, okay, you know what, my eggs will be there indefinitely. So I don't need to be pressured, about, running into any relationship. Even if you lose your uterus while you're waiting, you can always still get a surrogate. The embryo is still yours, right? So it just gives women more possibilities without the pressure. I know that, like in our culture, young professional women are under pressure, like, oh yeah, now you've got all the D's behind your name. It's time to get a man. It's time to settle down. Pressure. And some of these women are busy collecting all those D's that by the time they settle down, the eggs are gone. And I see a fair number of them. And it's really sad, to me, it's sad because these women are so desperate. They will subscribe to any snake oil treatment out there, trying to jumpstart their eggs. They'll go through any treatment. At that point in time, they don't care how much they spend trying to go through one treatment after the other. And it's heartbreaking. Excuse me, it's heartbreaking.
Oh, that's insightful. We're getting a lot of information here on egg freezing with Dr. Oluyemisi Famuyiwa. Let your questions keep coming in the chat. I have one that says, what happens to the frozen eggs if the woman no longer needs them because she's had her children naturally?
So her eggs, her choice. I don't tell women what to do with their own eggs. Remember, they're not fertilized, they're just eggs. Her choice, not my say. She decides whatever she wants to do.
Thank you so much. Dr. O?
Thank you so much. This brings us to our Medical Mondays moment. And please, if you have further questions, feel free to still post on the chat or raise your hands and they will still be answered. It's been an amazing day. This subject is very important. And we're so blessed with Dr. Famuyiwa, who comes at least once a month to give us medical facts on male and female fertility. Aren't we blessed?
Surely, yeah.
Yes, we are. Thank you.
I just want to say, Dr. O, I totally am in awe of you. I respect you. I admire you. And I can't thank you enough. I mean, this is just admirable what you're doing. Incredible. I can't even begin to think of the amount of work because I know how much work I put into just this little part. I can't even begin to think how much work. And I pray that God will bless you abundantly. Amen. For what you're doing. It's just wonderful.
Amen. Thank you. Thank you so much. Well, it's you and others that are making this possible. And, I appreciate you a lot. Thank you.
Thank you.
Guess what? Hannah and Ajay, the doctor and doctor, they did it again. They brought 10 people to the forum again last week.
Our layover is...
And so they are the ones.
Might be 2 hours or something like that.
Kindly mute. Kindly mute your phone. Thank you. Thank you so much. So they did it again, and they brought 10 people last week to Medical Mondays, and they are our Medical Mondays winner, Dr. Ephraim Ajay and Dr. Hannah Ajay.
And this is a special broadcast from the island, man, the island of Jamaica. Medical Monday from the island of Jamaica, man.
Yes.
Wishing all of you happy viewing, happy listening. Thank you.
Thank you. But you should show your face. Thank you. That is Madam VP and Lara Okunubi. We are in Jamaica together, and a surprise 60th birthday is going on right now. but I'm enjoying Medical Mondays. I'll go join them in dinner, dinner, in a few minutes when we're done. But, she's hollering from the event. So thank you, Ma. So our gift today will be Amazon gift card. And, so those are our recipients. Thank you again for always inviting people to Medical Mondays. If you invite 10 or more people, you get a gift. Just email me to let me know that, you brought 10 people or more. And if you invite 20 or more, you become a champion and you also get a gift. So I said thank you to everyone participating from the US, from Jamaica, Nigeria, Ghana, Canada, from all over the world, United Kingdom. I see my sister has been, texting me from the United Kingdom, from the UK, and, we say thank you. Thank you for participating. So I give it over to you, Minister Gustav.
Thank you, Dr. O, and a couple of charts. Well done, Dr. Famuyiwa. Great presentation. Wow, wonderful presentation. And one says, thanks, Doc. Everyone is different. How about Sarah's situation as she waited for the promise of God to come to pass?
You're asking me to comment on that?
Let me say that we're coming over you for your final thoughts on egg freezing, controlling your fertility.
Thank you so much. Again, I really thank all the hosts here, Dr. Popsami and Mr. Ajay. Thank you. I'm very, very humbled and privileged to be part of this. And I hope you've taken some information that you can share with people that you know as well. So feel free to reach out to Dr. Opesami. She knows how to reach me, and she can direct you. So I hope you take something out, and we look forward to the next topic that comes into my head to share with you.
Yes.
Thank you. Thank you.
Thank you.
Yes, can't wait for that. And I want to comment on that Sarah comment. So what can we say about Sarah waiting for her prayers to be answered? Even, we can say that God is supreme and God can do whatever he wants to do when he wants to do it. But I want everyone on this platform and everyone who will listen to the YouTube or Facebook to remember this, that God Almighty is the only physician, but he has given us, some of us, who have the achievement of having that certificate of MD, DO, and what have you, the knowledge to be able to treat different disease entities through research. God gives us wisdom in little bits. And part of the wisdom he has given us is the ability to freeze your eggs when you are not ready, when they are healthy, and to be able to provide them back to you when you are ready to have your children. And if you don't have that available, guess what? We can get eggs from healthy women that has been frozen, donated, or what have you, and you can use those. Those are God-given knowledge. Don't let us mix spirituality wrongly with health. It is important that we use the God-given information he has given us to treat, to sustain, and to better our health. We got all this knowledge through research that is given by God. So thank you so much again, Dr. Famuyiwa. Thank you. Nothing wrong with you freezing your eggs.
Absolutely. Please.
Thank you, Doctor. Thank you.
I have patients who will tell me, Doc, based on what I'm going through, as soon as my daughter finishes college and blah, 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 I'm going to tell her, let's start putting money aside for eggs. So yeah, it's something that you can use. So it's there.
Exactly. So please, everybody, if you please unmute and let's give Dr. Famuyiwa Medical Mondays, thank you with a round of applause. Thank you.
Thank you, Ma. Thank you.
And yes, Dr. Anna, knowledge is power.
Thank you.
Thank you so
Thank
much.
you.
Thank you.
Thank you so much. God bless you. You've been listening to Dr. Oluyemisi Famuyiwa, a fellow of the American Congress and gynecologist, and the founder of Montgomery Fertility Center in Rockville, Maryland, speaking about egg freezing, controlling your fertility. Thank you so much, Dr. Yemi, and each of you for coming. We continue our mission to inform, educate, inspire, and empower you with medical information and more. Till same time next week when we meet for another engaging conversation. My name is Gustav. This is Medical Mondays with Dr. O.